What makes me say that exercise is so beneficial? Well, one of the readings for this week is a review that summarizes a whole series of these meta-analyses and systematic reviews on exercise for mental health conditions. So as we saw, these are the top of the evidence pyramid, and this week's reading is a series summarizing 20 of these meta-analyses and systematic reviews. I'm just going to give you a high-level overview here because it's a fairly deep paper and it does talk about the strengths and limitations of all of these systematic reviews. But the evidence for exercise is looking pretty good for these severe mental health conditions. So if you can get people to exercise who have depression, then you do get a significant reduction in their symptoms. They're much less likely to be depressed at the end of that treatment. Now, that doesn't necessarily follow up. It's quite difficult to keep people moving and then keep their depression away. Relapse with depression is really common. And so some sort of ongoing relationship with your exercise practitioner is likely to be beneficial to stop depression coming back. The added benefit of getting people to exercise is you get cardiovascular benefits too. Now, you don't get that by going on medication, you don't get that by doing individual psychotherapy. This is one of the unique benefits of exercise as a treatment for severe mental health conditions. The other benefit is that you get this generalized improvement in quality of life, that people are happier about their lives as a whole. They're not just feeling less bad about themselves. So people get both physical and mental health benefits when they have depression and then they start exercising. And there was some evidence to suggest that that's even better when you get an EP delivering that training. The other two mental health conditions looked at in this review, the first one of those was schizophrenia. So as you may know, schizophrenia has got a combination of different symptoms. It's not having a split personality disorder. It has what are called positive symptoms and negative symptoms. The positive symptoms are the things that someone with schizophrenia experiences that you and I probably don't. So that might be like hearing voices or delusions, having beliefs about the world that aren't true, that are really hard to shake. And so those are called the positive symptoms, but the negative symptoms kind of look like depression. They're feeling very lethargic and down and not feeling like you're able to engage in life. For these people, exercise is really good at improving those symptoms. They have a positive benefit on both the positive and the negative symptoms. And also you get physical benefits too, cardiovascular benefits as with people with depression. So you're getting both symptom reduction for schizophrenia, or also other health benefits too. And this is really important because a lot of people with schizophrenia also struggle with physical health complications, and they're exacerbated by medications that sometimes make it even more likely that someone's going to have obesity or heart disease. One of the other benefits is that people who exercise when they've got schizophrenia get clearer thinking, they get better cognition, they're less likely to get intrusive thoughts that they can't get rid of, but they're also less likely to get caught up in that thinking and therefore interfering with their daily life. This review did try to look at bipolar disorder, which is like depression, but people with the disorder swing from feeling very depressed into this experience of mania where they feel actually very happy and energetic and on top of the world. So it's much more of a complicated disorder because people go from feeling really energetic and impulsive and happy to a point where they're making really bad decisions to feeling really down and lethargic and unable to engage in life. The studies on exercise for this population were less conclusive because there was only really one randomized trial that had looked at how people respond to exercise. So that's one area that we need to look at.